Thanks. Well, welcome everyone. This is Richard Mollett with the Long-Term Care Community Coalition, and welcome to our program today. We are just about to get started. Actually, I guess we are getting started. I just wanted to mention this is our, I think, second or third time using Zoom, so it went pretty smoothly last time, but please forgive us if there's any technical issues. Hopefully we'll be okay. This program is being recorded. We have both a chat function and a Q&A function at the bottom of your screen. So we're going to leave some time at the end for us to respond to questions. So if you do have a question, please put it in the Q&A and not in the chat, because we're going to be monitoring the Q&A. Excuse me. So today's program is a focus on a few important residents' rights. The right to vote, which we really wanted to focus on, of course, now in September. People still have time to register to vote. They have time, of course, to do absentee ballots, etc. And then also the right to self-determination and right to equal access to quality care. I personally have been concerned about so many rights have gone unaddressed and so many needs have gone unaddressed during the COVID pandemic period, and that it's really important for us to be aware, knowledgeable, and advocating for our residents to ensure that they do receive the appropriate care and services that they need. There have been a lot of rules that have been relaxed during COVID-19, but not rules related to residents' rights and not rules related to quality of care, not any rules related to quality of care. So if we see those problems, there's just no excuse. And then lastly, before we move on, this is our website at the bottom, nursingHome411.org. For those of you who are not familiar with us, we have a lot of different information, resources, and data available on nursing homes across the country on our website. Everything is free to use and share. So Eric, if you could please move on. So a little bit about us, for those of you who aren't familiar, the Long-Term Care Community Coalition, we are a nonprofit, nonpartisan organization. We're entirely dedicated to improving care and quality of life for residents in nursing homes and assisted living, adult care facilities. We conduct policy analysis and systems advocacy, both in our home state of New York, my home state of New Jersey, and nationwide. And then we do a lot of education of consumers and families, of long-term care ombudsmen and other stakeholders through programs such as this. We have a really fantastic new podcast series that's available on our website, as well as on Spotify, Google Play, etc. But we are working as hard as we can to get information and resources out to residents and families and ombudsmen and those who work with them. Unfortunately, we don't have the capacity to take on individual cases. I just want to mention that here. We're a small organization, but we're really doing what we can to improve care and conditions for nursing home residents. We are also home to 2 local long-term care ombudsman programs in the Hudson Valley of New York, just north of New York City. Joining me today is Eric Goldwine. You saw him before. He's LTCCC's Policy and Communications Director, and Eric joined us last year, and I am Richard Mollett, LTCCC's Executive Director, and I started with the coalition in 2002, and I've been the Executive Director since 2005. Next slide, please. So very quickly, today's agenda. Eric is going to provide us with some updates on COVID-19 data and policy developments. We've been doing this every month, so do check in with us. He provides some really good information on what is going on out there, and both out there in terms of policy developments, and in there in terms of, what are we hearing, what do we know is going on in facilities based upon the data that they're reporting. And he also lets you know where that data can be accessed if you're interested as well. And then we're going to focus on residents' rights, as I mentioned before, particularly at this point, voting rights, information and resources. And then we're also going to touch upon a couple of other important residents' rights. And then we'll end with some resources for advocacy that you can use now, as well as leave some time for Q&A. Next slide, please. And I think I'm going to hand it over to Eric. Eric, you're on mute.
Yeah, I got it. Yeah, so thanks, Richard, for the intro. Hopefully everybody can hear me. Give me a thumbs up if you can hear me, Richard. There we go. So I'm going to first start by just giving a few updates on COVID-19 long-term care data and policy developments, starting with the data, then discussing visitation policy, then reviewing a recent announcement about testing, rapid testing in long-term care settings and the issues surrounding that. So first, you might be familiar with a version of this slide as I've presented before. I'm going to go over the cases and fatality and the data that is available both at the federal and at the state, or specifically New York State level. There's an excellent resource on Kaiser Family Foundation, which provides a lot of these numbers. Now, on the top right, as I've mentioned before, these data are data. They don't tell the full story. There's also issues with data entry. There's issues with underreporting, overreporting, and they only capture what they are. They don't capture the full story. For instance, isolation, abuse, neglect, the impact of lack of visitation and isolation. So with that said, I'm going to review a few numbers. According to Kaiser Family Foundation's September 4th data, there are or have been 468,000 COVID-19 cases among resident and staff in over 18,000 long-term care facilities in the United States. Their total fatalities, COVID-19 fatalities, is 76,000, which is about a 10,000 increase from where we were a month ago. So it's important to note that the U.S. has a lot of variation as far as where these cases are happening. If you look at New York's data, in New York, fatalities have plateaued. There was a rapid increase in March, April, May, and as you see in the graph on the bottom right corner, there has been a plateau in the number of fatalities and the number of cases. And another important data point to note is that the cases and fatalities are also being tracked by at the federal level, and their data does not align with what we're seeing elsewhere. They have 345,000 cases, and again, Kaiser Family Foundation had significantly more at 470,000, and the same trend occurs with fatalities. So I know a lot of you are interested in visitation policy and guidelines, and I was thinking about it earlier this morning, how long it's been. It's been 186 days since the initial lockdown in mid-March. And just to put that in perspective, we've gone through Easter, Passover, Ramadan, Memorial Day, July 4th, Labor Day, birthdays, weddings, anniversaries, funerals. It's been such a long time. It's been over 6 months. And I know that can be hard on residents and families. And it has real physical and psychological health effects. And it takes a big toll. As far as current policy, as many of you are aware, the current CMS reopening recommendations are 28, or a facility should have 28 days without new cases, and there should not be staff shortages. There must be sufficient PPE and testing. And there are exceptions on compassionate care, and that's not just end of life. There are other circumstances in which CMS is reopening recommendations or visitation recommendations allow for compassionate care visitation. Now, in New York, there was a recent policy change that has limited visitation in pediatric nursing homes and adult care facilities. And the main change there is, rather than 28 days, as you see a full moon cycle, it is down to 14 days, which is something we see as an improvement. However, this is a policy change that we would like to see, or not necessarily this policy change, but we would like to see less restricted visitation, not just in pediatric nursing homes and not just adult care facilities, in all nursing homes. And just a few of our resources and recommendations as far as visitation policy. We signed on and were involved in recommendations that allowed for outdoor and indoor visits for all residents. And our feeling is that if outdoor is not possible, then residents should be allowed indoor, whether that's health-related reasons or weather-related reasons. Another aspect of this recommendation is that residents, families, ombudsmen should be informed about visitation policies. Any visitor should be screened before the visit, and all residents should have access to visitors. Now, I would also, and this is available on our website at this link at the left side of this page. I'd also recommend looking at Canner's Visitation Saves Lives campaign. You can log on to visitationsaveslives.com to look at their recommendations and also to share your story on Facebook, on Twitter, on social media about why visitation matters to you. And also back a few months ago, LTCCC published our blueprint for restoring visitation rights. And we recommend that every resident has the right to support a visitor in person, and that there should be safe and reasonable accommodations. And a last policy note before we get into the residents' rights portion of the presentation is that last week, the Department of Health and Human Services announced they would be providing 750,000 COVID-19 point of care tests. These are fast antigen tests, which would be free for facilities and would target counties designated as red or yellow, which means that they have higher risks and higher risks of COVID transmission. Now, this on its surface is better than nothing, but we're very concerned that there still lacks a long-term plan. 750,000 sounds like a lot of tests, but with the amount of tests that are needed, that is not going to last forever. And we're just concerned about what's next. Okay. So now we're,
I'm sorry, go ahead.
So now we're going to discuss a residents' rights. And Richard, you actually want to take this slide here?
Sure. So thanks, Eric. That was really helpful. I'm getting a little bit of feedback. Maybe that stopped. I'm not hearing right now. Okay, good. So I just wanted to mention before we move on to this slide, in terms of the testing, that CMS held that the Centers for Medicare and Medicaid Services held a call for the industry last week, and they announced, in addition to testing, that they had provided about $5 billion to the industry to help pay for testing, to help assure that staff could be, in the facility, sufficient staffing, and also staffing that wasn't, that was paid, hopefully to come into the nursing home during these stressful times, et cetera, and to, ensure that, again, the staff was really supported. So it's just important to know that the facility, the industry has been getting a lot of money and a lot of resources. That's just one of a lot of different funding that they got, that it's so important that that funding be directed not to, increasing profits, but it's funding at this critical time to meet the critical need of residents. So now moving on here, and the meat of the program. Of course, the COVID-19 updates are extremely important, but I've been really concerned about what I've been hearing for many, many months now in New York and New Jersey and nationwide, actually, about reports of serious neglect of residents not being cared for. Part of that is, and it gets to the concern, that we've had from the very beginning about family members, long-term care ombudsmen not being allowed to go into facilities. As Eric was saying, that's starting to loosen up a bit, but it's still way, way, way too strict. I hear it from so many family members, and thank you for getting in touch with us. It's horrifying and heartbreaking to hear of what residents are experiencing. So we're concerned about the visitation, as Eric was saying, but what I wanted to mention here is that we're really concerned also about the neglect that's going on without having eyes in the facility, without having regular inspections, which we didn't have for a very long time, that residents are deteriorating. Residents are both suffering from lack of care, they're suffering from neglect, and they're suffering from isolation. And we have heard reports of residents literally dying because of lack of contact with loved ones, with families, social isolation, et cetera. So what we wanted to do is start talking about, let's start talking about these residents' rights that exist, that are ongoing now, which we have a right to expect from facilities. And we're starting really at the very beginning in terms of residents' rights. This, you can see the actual number one is, I clipped this from our primer. We have a primer, as you can see on the left-hand side here, Nursing Home Quality Standards, a primer for residents, families, ombudsmen, and advocates. And we have a nice description, I think, of kind of the lay of the land for nursing homes and for residents and who provides oversight, et cetera. But the heart of the primer is on what are some of the essential quality standards that we have identified over the years, and what do they mean for residents? So this is number one. It really gets to the general residents' rights. And I'll just talk about it a little bit. Everything in italics in the primer and everything here is in italics comes directly either from the federal regulations or the federal guidelines for how those regs are expected to be implemented. So here, the resident has a right to a dignified existence, self-determination, and communication with and access to persons and services inside and outside of the facility. The facility must treat each resident with respect and dignity and care for each resident in a manner and in an environment that promotes maintenance or enhancement of his or her quality of life, recognizing, again, each resident's individuality. The facility must protect and promote the rights of the residents. So this is a general layout of what is expected, and all the individual rules and requirements that follow go to implementing that. They all speak to that. And we've done a lot of work in this area over the years and worked a lot with the guidance, with CMS on the guidance for these rules. And I can tell you that every single rule really gets back to how are we recognizing the individuality of residents, and how are we meeting his or her needs in the way that is most likely to facilitate his or her dignity, her ability to live a comfortable and as full a life as possible in the facility. A couple of things I wanted to mention because they really relate to the voting that Eric will talk about in more detail, but the resident has the right to exercise his or her rights as a resident of the facility and as a citizen or resident of the United States. And I have to tell this to people all the time, and sometimes even remind myself, because it's so different from what residents and their loved ones experience in many nursing homes. That so many nursing homes are, you go into a nursing home and it's like you're no longer a citizen of the United States, and that's just not true. And here you can see it in writing. So I'm not going to go through these all right now, but you can see they're here, and I'll talk about them a little bit more specifics later on. And we're going to be focusing on, I think, some of these residents' rights during the pandemic, especially in our next few monthly programs, to again kind of plug in. The last thing before moving on, I just want to mention the last paragraph here. The resident has the right to choose his or her attending physician. so many family members, so many ombudsmen that I speak to over the years, even facilities don't seem to realize or don't choose to realize or recognize that the resident has the right to choose his or her own doctor, and the facility cannot put up a blockade or roadblocks to ensure that he or she is able to choose a physician. So it has to be someone that the facility is, of course, willing to let into the facility, et cetera, but they cannot make that too onerous. That again, the resident is an individual. The facility is not a storage unit for oranges or cargo or magazines or whatever. It is a home for people. Nursing homes are paid and expected to be meeting standards of care and quality of life for every single resident. And next slide, please. I'm sorry. So I think that was just kind of the lay of the land that I wanted to provide at the beginning. And I'm going to hand it over to Eric now to talk about voting rights. You're muted, Eric. It doesn't look muted, but there's no sound coming out.
There we go. How about now?
Oh, there you go. Yeah, that's
okay.
Good.
Thanks, Richard. So I'm going to spend the next 10 to 15 or so minutes talking about residents' rights to voting. As we're all well aware, we're less than 2 months away from the 2020 election, and mail-in ballot deadlines, registration, all of that is well before the election day itself. So I'm going to talk about voting rights in long-term care settings. And I want to start by just talking about who are the long-term care voters. So this slide is about a man named Walter Hutchins. He's the feature of a ProPublica article, which I recommend checking out. The link is on the bottom. But Walter Hutchins he's a nursing home resident. He's an industrial engineer, an inventor. He helped design the M16, and he resides at a nursing home in Wilmington, North Carolina. He has voted in 68 consecutive years. His first vote was for Dwight Eisenhower. Here's a picture on our right, just to give you an idea of how important voting is to Walter. He's voted in fire stations. He has voted in churches, retirement communities, but he needs help voting. He's blind. He's hard of hearing. And usually in past elections, he has had assistance from his family. However, COVID-19 is going to put his voting streak in jeopardy. State law in North Carolina prohibits staff from helping with ballots, and due to visitation restrictions, visitors might not be able to help him in person. So that means his wife, Margaret, his 4 kids, his 8 grandchildren are not able to help. And here's a quote from Margaret, his wife. "It makes me angry that something like this could happen and that we'd be denied the right to vote just because of our age and condition." And here's another example I saw on Twitter yesterday. Dr. Bob Watcher, he's a physician at a California, in California, and he tweeted, "Visiting my 90-year-old dad, who is sadly nearing the end, an 84-year-old mom." And dad is pretty clear-eyed about his future and says he's ready to go, but he has one thing that he still wants to accomplish. "I want to stay alive long enough to vote." So this is a fundamental issue for nursing home residents, like this 90-year-old man and like Walter. So there are 2.2 million residents in nursing homes or residential care. As noted before, voting is a fundamental part of their identity. Older adults are often referred to as the backbone of American elections. They're more likely to vote than the younger age group, and this election is especially important for the nursing home and long-term care population, because this is the population most impacted by COVID-19 policy. And just to get this out of the way, this is a nonpartisan issue. If you look at the 2016 breakdown, older adults, we don't have specific long-term care voting breakdowns, but older adults 65 plus were more likely to vote for Trump than Clinton in the 2016 election. But no matter the breakdown of how this is, we find this to be an essential right for this upcoming election. So the voting rights of long-term care residents, as Richard mentioned in a few slides ago, federal rules for nursing home protect residents' rights, including voting rights. So you can see here, the resident has the right to exercise their rights as a resident of the facility and as a citizen or resident of the United States. The facility must ensure that the resident can exercise his or her rights without interference, coercion, discrimination, or reprisal from the facility. And the resident has the right to be free of interference, coercion, discrimination, reprisal from the facility in exercising his or her rights, and to be supported by the facility in the exercise of his or her rights as required under this subpart. I have not been studying this issue for all that long. However, I want to kind of give the floor to Nina Cohn. I'm going to play a clip from her. She is an elder law expert who has been writing specifically about long-term care voting policies for more than a decade. For longer than a decade. And what she told me is the right to vote is a fundamental right, and living in long-term care does not undermine that. And I'm going to play this clip. It's from our Nursing Home 411 podcast.
So I want to start with the basics. What are the voting rights for long-term care residents, and how do or don't they differ from that of other U.S. citizens?
So residents of long-term care facilities have all the voting rights that they would have if they were not residents of long-term care facilities. The right to vote is a fundamental right, and living in long-term care does not undermine it. But actually, residents of nursing homes that take either Medicaid or Medicare funds, which is almost all nursing homes, actually have some additional rights. Under the Federal Resident Bill of Rights, residents have the right to be supported by the facility in exercising their rights as citizens of the United States. So nursing home residents living in facilities that take federal money have the right to have those facilities help them with voting, to support their voting.
Okay, so yeah, if you don't believe me, let's believe our scholar and expert, Nina Cohn.
So I want to start.
We don't want that. Okay, so barriers to disability or barriers to voting include disability and environment. Now, cognitive impairment is a complicated issue when it comes to voting, but it does not necessarily preclude residents from voting, and these laws and regulations vary state to state. I want to quote an article from the American Bar Association. People whose mental capacities are clearly intact may vote for candidates based on any whim or reason, rational or irrational, profound or frivolous. So I think that conveys what the rights of voters are. There's also physical disability, which can get in the way of voting, such as reading a ballot or filling out the form, and residents are entitled to assistance if they are disabled in filling out their ballot or registering or completing their vote. And there's also access to information, or perhaps limited access to information, which might get in the way of a resident understanding a deadline for registration, the date of the vote, and the facilities have a responsibility to convey this information to residents under their care. Now, COVID-19 is a perfect storm for preventing and blocking voting from long-term care residents. This is an already marginalized group. In previous elections, there are reports that they've lost their opportunity to vote or have been unable to get help casting a ballot. And worse, not only are these violations underreported, but they're categorized as low severity or little to no harm, when we know that robbing residents of this essential right is harmful. The ProPublic article I mentioned a few minutes ago noted that hundreds of thousands of nursing home residents may not be able to vote in November because of the pandemic, and this is because of restrictions on visitation, lack of access to ombudsman, suspended programs for election officials to enter the facility, and a lack of oversight. And what Nina mentioned to me is we're headed for a perfect storm unless there's a quick correction. And with that in mind, there are things that we can do, you and I, ombudsman, caregivers, to facilitate voting in this uniquely challenging environment. So I'm going to plug our new Nursing Home 411 voting page, which includes some of these resources, and I'm just going to highlight a few of my favorites. And again, you can get this information at nursinghome411.org/voting. So vote.org, that's vote.org, is a tremendous resource that can give you information on registration and voting, whether in person or by mail, for every US state. So as an example, if you went to vote.org, you could find a link to New York's election page, and you would be directed to a screen similar to what you see on the right, where you can check your registration, you can register to vote, you can be pointed to directions on voting by mail, and you can get election reminders. This is my personal favorite resource on the Washington Post. They have a how to vote webpage, and this is for every US state. Here we show our options on New York, where you can click, are you registered to vote? How do you plan to vote? And it will direct you to the deadlines, whether you're registered, whether you're not registered, whether you want to vote by mail, or whether you want to vote in person. And again, this is every US state, and there's additional information provided. And the National Consumer Voice has several voting fact sheets, including one that is how to cast a vote, alternatives to traditional voting for consumers of long-term care, absentee voting, early voting, voting in facility. And they also have a tremendous fact sheet on cognitive impairment and voting. They call it a complicated issue, and that's an assessment I agree with. The regulations and restrictions vary across states, and there are both legal restrictions and practical barriers, and you can access that fact sheet on the link on the bottom right. Okay, and I'm going to pass it off to Richard.
Thanks, Eric. That was really informative. And again, just to reiterate, it's up on our website. It's free to use, free to share. We really welcome you to share any of these resources, but especially now, if people want to vote or are concerned about voting, now is the time as quickly as possible to move to make sure that happens, both for those of us living in the outer community and for individuals living in nursing homes and other adult care facilities. So I'm going to talk about a few of the resident rights that I mentioned earlier, a little more detail. The first one is self-determination. Next slide, please, Eric. Thanks. So I included here the front page of our two-page fact sheet. As many of you know, if you're familiar with our work and these webinars, we We've developed these fact sheets over the last several years. They have been updated for the new regs, and each of the fact sheets essentially takes one of the topics from the primer that I had mentioned earlier that has a lot of different issues, and it boils it down into almost all of them are a two-pager, front and back. So people can use these to advocate for themselves, to know their rights, to know their loved ones' rights, to use as a family or as a resident counsel for ombudsman trainings and for other volunteer trainings, etc. So this one is, and it talks about some of the things that I spoke about earlier, the fundamentals of resident rights, dignity and respect. I want to know, and I neglected to do this earlier, as you can see in purple, these are the headings of the different subsections of the code or different topics. The first one, standard one, is resident rights. The second one is exercise of rights. And then the last purple heading is intent of this regulation, and that is taken from the guidance. So I just want to mention, I hope that you can see here, all of our fact sheets and the primer as well include two things you'll see on the right-hand side in the purple bold. One is a number 42 CFR, this one's 43.10A. That number, the 42 CFR number that you'll see accompanying every single standard and all the work that we do goes back to or brings you back to the code of the US federal regulations. And that's really important because I want people to know when I talk to family members about this, when I do trainings, when you take these materials, that it's just not my opinion. It's not something that I made up. It's easily verifiable just by plugging in 42 CFR 43.10 into your internet browser, and you could get the exact information. So if a administrator or director of nursing says, well, what makes you think you have that right? You know that, again, it's just not me. It's not just Richard Mollett from Long-Term Care Community Coalition or Eric Goldwine from Long-Term Care Community Coalition told you that these rights actually exist. Secondly, and we include this also with all these materials, you'll see there's a second number. It's called an F number, F tag actually. And it's F, this one is F-550. We include these are called the F tags. And those are the tags that are used by the state surveyors, the state, Department of Health or Department of Public Health, when they come in and when they do a survey, an inspection of a facility, if they find that there's a violation of one of the standards, that violation has an F tag that is associated with it, or the standard, has an F tag that is associated with it. Why do I include this here, and why do I think it's important? If you are involved in a facility, if you live in one, if your loved one lives in one, if you're advocating in one, you have the right to see their most recent citations. It's called a Statement of Deficiencies. That Statement of Deficiencies also has to be on your state website, and it's on the federal website, Nursing Home Compare. It's medicare.gov/nursing home compare. And when you look at the deficiencies for any facility, again, you can see this visiting the facility or on the state or federal websites, you can see exactly what they were cited for. And on the state websites and in the in person in the facility, what you'll generally see is it has on one side, it'll have what the citation was, the F tag number, and what it was. It'll be written out what the facility did or did not do that resulted in that citation. But on the right-hand side, it'll show the plan of correction, what the facility is going to do to one, correct the problem, and to make sure that that problem does not happen again. So this, in short, this F tag is really important, really valuable, because if you're working in a facility, you can see what they were cited for, and you could use this to support your advocacy to make sure that that problem does not reappear, that problem is addressed in a meaningful way. So that could be really useful for family councils and resident councils, and for anyone, including, of course, ombudsman, who is working to advocate for better care in the facility. One of the biggest problems we see, and why I think many of us are here, is because we know that nursing homes, unfortunately, have, not all of them, but most of them have persistent problems. The average nursing home has, I think, 7 or 8 healthcare violations that are identified every single year, and who knows how many more that are unidentified. But even of perhaps of greater concern, to me at least, is that the federal data have shown that many facilities have what we call chronic deficiencies, so that they have the same violation or violation for the same care standard over and over and over again. And we did some work with Voices for Quality Care and other organizations around the country. Several years ago, we actually hired somebody to go through all these violations, the whole database, and identify facilities that had 3 or more violations for the same regulatory standard in the 3-year period on the Nursing Home Compare database. And we found that a whopping 42%, according to federal data, of nursing homes have these chronic deficiencies, the same violation over and over and over again, meaning that they just were not doing a good job in correcting it. So we have some reporting on that actually on our website. We have not updated that recently because the system, the number system changed, the enforcement system changed a bit with the new regulations that came out in 2016, new surveyor guidance that came out in 2017. I don't want to get too much into the weeds here, but this information, again, just to come back, can be really helpful for those of us who are working to address some of these persistent issues, whether on an individual facility level or more globally. Next slide, please. So next, I want to talk about some of residents' rights to quality care. Next slide, please. So number one, and this is not our piece, this is actually from Justice and Aging. It's another organization based in, I think, in California, but they also have a DC office. And Eric Carlson, who has been a longtime advocate for nursing home residents and for, I think, Medicare and Medicaid issues. And he has this excellent book. It's actually, you can see, hopefully on the lower right-hand side, Justice and Aging, and their website is justiceandaging.org. This is a free book. It's called 20 Common Nursing Home Problems and How to Resolve Them by Eric Carlson. It's a great book. It's available for free now as a PDF. I actually purchased a hard copy when I first started and before all these things became more widely available. But in any case, I highly recommend it. This is problem number one, which I wanted to raise with you all. It's an issue we see over and over again. It's in regard to discrimination with care and with quality of services by nursing homes in respect to the source of a resident's payment. So as many of you probably know, nursing homes are paid, most nursing home care, is paid for through Medicaid, which pays for long-term care. And then I think it's about 20% roughly of nursing home care is paid for through Medicare, which pays for short-term rehab. And then the rest is either private insurance or out of pocket. Medicaid pays on average about $225 per resident per day, substantial amounts of money. However, Medicare pays oftentimes many times more, could be $400, $500, $600, even $700 or $800 per day for residents' care. And part of that, I would say there's really 2 reasons for that. One is we kind of discriminate against lower income people in this country. So Medicaid is not seen as valuable a program as Medicare is, but also for the Medicare resident, that higher cost is also supposed to include therapy services, because someone is in there for rehab, which is what Medicare again pays for. They are in need of more therapy services, generally speaking, than someone who is in a facility on Medicaid, which pays for long-term custodial care. So, however, the point here is that facilities cannot discriminate in terms of services and level of services or quality of services that they provide to a resident. So it is completely inappropriate and contrary to the federal rules for facilities to say, well, you're no longer eligible to receive certain services because you're a Medicaid resident now, your Medicare has run out. That's not right, but unfortunately that's something we see. We see a lot of discrimination against residents with Medicaid because facilities want to go after and want to focus on those people who are bringing in much bigger profits. So there is profit making, frankly, in the industry across the board, That's certainly something we could touch on further, something, you know, in another program. But suffice to say here is that a nursing home is obviously making a lot more money from someone for whom they're being paid, say, $600 a day, as opposed to someone for whom they're being paid $225 a day. However, again, you are a medical service provider. As I tell people, when I talk to people in Washington, D.C. or in one of our state capitals about this, we all have things in our lives that are easier and things in our lives that are harder. That's part of life. That's part of our work lives as well. And no one in other settings gets to say, oh, I only want to do the easy work. I don't want to do the hard work. You have a mix of things in your life, and nursing homes that agree to take in residents and agree to provide safety and care and to meet the federal rules in doing so have an obligation to, in essence, you know, take the mix of the residents, and the federal rules really get at that. And this is again a great piece to just help people advocate for that specifically. Next slide, please. Great, thanks, Eric. So this is our fact sheet on resident care and well-being. And again, this is the slides, I believe, are on the website. I think Sarah posted the link already. And the fact sheets themselves are on our website, easy to search. So here, this fact sheet is on resident care and well-being. If you go, we have a section or subsection on fact sheets. It's part of our learning center on the website. Everything is free to use and share and download. We're really happy if it's useful to others. But this fact sheet focuses on quality of care. So we look here at vision and hearing to ensure that residents receive proper treatment and assistive devices to maintain vision and hearing abilities. The facility must, if necessary, assist the resident in making appointments by arranging for transportation to and from the office of a practitioner specializing in the treatment of vision or hearing impairment, or the office of a professional, in the provision of vision or hearing assistive devices. Vision and hearing. The next bullet point we have is skin integrity, pressure ulcers, a huge issue for nursing home residents. About roughly, I think 7 or 8% of nursing home residents have pressure ulcers or even have been identified as having pressure ulcers. It's likely that many more, in fact, do, and it's just not identified, or it's identified too late. This is a huge issue and a persistent issue for residents, and a key indicator, frankly, of a nursing home's quality. The rule requires, the federal law requires that a resident receive care consistent with professional standards of practice to prevent pressure ulcers and ensure that they do not develop pressure ulcers unless the individual's clinical condition demonstrates that they were unavoidable, and that a resident with pressure ulcers must receive necessary treatment and services consistent with professional standards of practice to promote healing, prevent infection, and prevent new ulcers from developing. So important, because this is one of my biggest concerns and fears at this time, that residents, they're not being given as many activities, if any activities, as they have prior to COVID-19. The facilities too often, from what we hear, are not undertaking other activities. So yes, maybe socialization is not safe. Maybe group activities may not be safe close together, but good facilities are doing other things. They're doing, you know, chair aerobics in the hallways. So people are separate from each other, say 6 feet apart, but they're able to have movement. They're able to be engaged mentally as well as physically. That facilities have appropriate staffing. That's what they promise. That's what they're paid to have, to ensure that residents are monitored and repositioned to avoid pressure ulcers. So this is just so important, because they are, for the most part, very easily avoidable and treatable if they do start out, if a resident is properly monitored and receiving appropriate care. And again, those rules are still in place. And then lastly, I just wanted to touch on incontinence. It's on the upper right-hand side. It's another big issue that is, I think, an often a frequent problem and frequently unnecessary problem in nursing homes. The facility must ensure that a resident who is continent of bladder and bowel on admission receive services and assistance to maintain continence unless his or her clinical condition is or becomes such that continence is not possible to maintain. This is a really high bar if it was properly implemented and if it was properly enforced by both the states and CMS. What this says, in essence, is that someone should not be put into a diaper for the convenience of staff. And that's what we hear time and time again, even before COVID-19, and now even more so. I'm just hearing heartbreaking stories about things like this, where residents have lost continence, they have been put into a diaper, they've been put into a double diaper because no one's coming to take care of them for maybe another day, maybe 2 shifts or more, and that's it. That is completely unacceptable. Nursing homes, again, they haven't taken a cut and pay. As I mentioned earlier, they're getting increased money, but they've still gotten paid every day to provide appropriate staffing and services. And if they can't do that, they need to not accept more residents until they have the staff and the ability to do that, period. Just like I mentioned before, with all of us with work, we don't take on work that we can't do or have no intention of doing without knowing that we can face repercussions. And from our perspective, it is long past time that the nursing homes that are failing to do this, that they face repercussions. Because frankly, there are good nursing homes out there, as I mentioned before, but it makes it even harder for them because they spend more on care, and that makes it less viable as a business compared to those who are getting away without having any enforcement, any penalties, and they're not providing that level of care. So we provide this information. Again, these are fact sheets that are freely available to use and to share to support advocacy. And that advocacy could take a number of different forms. I just want to quickly mention before we move on. It could be, as you see here, we have a checklist, maintaining physical and emotional well-being checklist for people. We have a lot of tools now that we've developed since this, since the fact sheet, to help people track issues and to help address them with for themselves or with their loved one or with their resident. And so one thing that you can do is that you could use these fact sheets to facilitate getting the care you need or the care your loved one needs in the facility by alerting care staff, by alerting nursing staff that, look, this is what your rights are. How can they help you achieve those rights? So that's number one. That's always the best place to start, is to try to engage people on these rights. But then secondly is that if you're not being heard, if you're not being responded to, things are getting worse. If you have growing pressure ulcers, or you have someone who's not getting help with hearing assistance and a hearing aid for a long period of time, is that you could take this up to management. You could take this up to your state or federal legislature. You could take it up to your state Department of Health and say, look, I know I have the rights here. This is just not my personal complaint. It is my personal complaint, but it's also a personal complaint that is based on the law and on the rules. Next slide, please. So I'm going to talk a little bit about some of the resources we have. As I mentioned, we have a Family and Ombudsman Resource Center, and that has, well, on the upper left-hand side here, you can see we have the Learning Center. The left-hand side, we're actually in the midst of changing this, so it's going to be, instead of drop-down menu, but you get the picture, is we have the Learning Center, we have Nursing Home Information and Data, we have Action, an Action Center, we have information about our organization, but we try to make it as easy as possible to access this, any information, any resources. So at the bottom on the left-hand side, there's that search function, the little eyeglass. But then you could also click on the Learning Center to see some of these resources. Or here on the Family and Ombudsman Resource Center, you can see the first, on the first column of boxes, buttons, is fact sheets on care standards and resident rights, all the things I'm talking about. The Dementia Care Advocacy Toolkit. On the right-hand side, you can see forms and tools for resident-centered advocacy, upcoming webinar programs, past webinar programs. So you can see and use these tools hopefully as easily as possible. Next slide, please. These are just quickly some of the forms and tools for resident-centered advocacy. We have them both as Word files and PDF files so that hopefully they could be useful to you if you want to print them out, or if you want to fill them in on your computer or on an iPad or other tablet or on your phone. Next slide, please. And this is just very quickly a resident preferences form, so you can kind of see what some of these forms look like. And again, they could be printed out, they could be used, you could take them with you to care planning meetings, you can use them or share them. Now, of course, we're all meeting remotely, electronically. They could be kept in electronic form as a PDF or as a Word document, or they can be, of course, scanned if you filled them out by hand. Next slide, please. This is another record-keeping form. Next slide, please. And then this is our Citizen Action Center. So we have action alerts both for our home state of New York, as well as national action alerts on issues related to staffing, related to safeguards and assisted living. We have Tell Your Story, which we ask people to share their story with us because that helps support our advocacy on behalf of residents across the country. So, and thank you for those of you who have shared. It's very valuable. Lastly, thank you all for joining us today. For more information, please email info@ltccc.org or call our main line to receive alerts for future programs or to sign up. Our next program will be October 20th. We will again do an update on what's going on. Hopefully we'll have more information and on visitation, which I know is an issue everyone is concerned about. We're hoping there'll be some changes by then. And we're going to continue talking about some specific resident rights that we think can be useful and supportive of resident advocacy in the months, weeks, months, et cetera, to come. Next slide, please. Thanks. So with that, we're going to open it up for questions and comments. Again, I apologize. We cannot help people with individual problems. We don't take cases, for instance, or provide legal advice, but we do appreciate hearing your stories, and we do hope that the information and the tools are useful. If you're a long-term care ombudsman and if your supervisor will allow you to take credit or have credit for attending this program, please take a quick survey. You can see the link below, surveymonkey.com/r/LTCCC-LTCOP1. And with that, I'll open up for questions. We can stay a few minutes longer too if people are interested for the Q&A. Sarah?
Thank you, Eric and Richard. So the first bunch of questions are about voting. How do you help residents through the voting process without appearing to be pushing them in either direction? If there's a guardian and the facility, which one is responsible for arranging for the resident to vote? And if the resident doesn't have computer access, what do those residents do? So,
Eric, I'll leave it up to you, or I guess we should probably take them just a little bit more slowly, sorry. In terms of helping residents without appearing to push them in one direction, I mean, I think that's true with anything. Just like I was saying before about residents' rights, is that the resident has the right to be met where he or she is living, where his or her needs are, where his or her goals are, et cetera. That's not determining, oh, I think this is what's best for you, or I think this is what you will like, but being provided, if possible, with resources or information, if that the resident can understand, whether that be TV or magazines or whatever. But in any case, it's really just there's, from my perspective at least, there should be no coaching by anyone. There should be no guidance. It's really helping facilitate the physical voting, active voting, whether it be through a ballot, et cetera. It is not guiding them into how they should make a choice. Eric, I don't know if you want to add anything to that.
Yeah, what you said is correct, and of course there can be a perceived fine line between assisting someone in voting and maybe pointing them in a direction. But the point of voting assistance is to provide the information about the vote itself, telling when the dates and the deadlines are, and B, helping with the physical assistance in as far as filling out the form, whether that's assisting with reading or filling out the form itself. One thing I'll add is that there have been reports in past elections, or I should call them allegations of fraud of a staff member, perhaps coercing residents to vote in a certain direction. There is not any widespread evidence or any evidence that this is happening in any sort of widespread or consistent manner. There's no widespread evidence of voter fraud in this kind of situation.
Thanks, sir. Sarah, I know there were a couple others regarding voting, so why don't we take those?
So if a resident has a guardian but still retains the right to vote as determined by the court, who's responsible to help the resident vote, the facility or the guardian?
Well, everyone is responsible. So everyone should be taking, anyone who has the ability to do so should be taking action to support the resident. And so, yeah, that would be my answer.
And
No,
that
don't
would be
pass it off to someone else. Yeah.
that would be the same for if they had no access to computers. Thing.
Correct. Yeah. There's other ways in which they can, in which their voting can be facilitated.
Okay. So the next subject is about seeing physicians not in the facility. So we hear from residents all the time that are not being permitted to see their own physicians. Insurance and payment become issues, as well as transportation. Is it correct that even if the resident sees his own physician, the facility is not bound to follow that physician's recommendations?
Well, I think that Pat's question is really a good one. I mean, there are, as I mentioned when I was speaking about it, that so many people are not even aware that residents have this right, and so which makes clear to me that right is often not implemented in the lives of residents. So I think this is very challenging. But if a resident's physician provides, direction for residents' needs, whether it be medication, whether it be, other clinical services, et cetera, then the facility is absolutely obliged to follow through with the physician's directions. But I do recognize, as I think Pat is trying to say here, that this is very challenging that we see facilities put up roadblocks by saying that they're not going to provide transportation. And now under COVID, I'm hearing from families saying, that the resident can't get out to go to appointments, that some facilities are making it even harder. But it's not a prison, and residents have the right to, again, see a physician. Yes, it can be someone that the facility has deemed has visiting privilege, et cetera. But as I mentioned when I was talking about it, the facility can't put up significant roadblocks so that only their own doctor is the one that is able to provide physician services if a resident wants to go someplace else. I think two more questions, Sarah.
Oh.
If there's two more.
There are many more than two more.
Okay.
So please focus on the rights that have been stripped from nursing home residents. Talking about voting is one thing, but even more fundamental, their rights have been stripped. How about those with dementia who are being isolated and have no voice? Please talk about the criminal activity of immunity that's stripping residents' rights.
Thanks. Well, we'll talk about we talked about some of the rights, and we'll certainly talk about others. So thank you for that comment. So, are there any questions?
Of course, I'm sorry.
That's okay.
Is a facility obligated to provide transportation to an outside doctor? Is a facility obligated to implement prescriptions from an outside doctor? I think you answered that one also. I
Yeah,
apologize.
the facility should be, and you can see in the rules, which makes them so useful for advocacy, is that the facility has to facilitate those things. And sometimes you do need, and that's why I've said a couple of times that we can't provide legal advice, and we're not able to provide individual guidance. But I think that those are things that I would certainly advocate for, and that those are things that the facility should be taking steps to do. And if there's things that are making that impossible for the facility to do, then the facility should be explaining why it can't, for anything, and particularly here, and coming up with, some reasonable alternatives.
I think that that's all your
Great.
questions.
Well, thank you everyone for joining us today. Thank you, Sarah, for asking the questions. Eric, great presentation, I thought, and it was very, very helpful. Always informative. Again, please, this is not a partisan issue at all. We want to make sure that obviously that residents are cared for, that they can have visitation, as we share what many of you have told us about your concerns and have for many, many months, as I know you have as well. Here today we focused a lot on voting, because now is the time to really move on that, and the resources that Eric had posted are really good. They are on our website now. That page is live, very easy to find and to utilize and to share. So thank you everyone. Hope to see you in October. Have a good afternoon.